All right, welcome back. How many times have you heard that losing weight can impact your overall health? But what does that really mean? Joining us this morning to break it down and simple ways to understand is Dr. Eric Paul, a bariatric surgeon with Baptist Health. Dr. Eric, thank you so much for being here.
Good morning. Thanks for having me.
So we are always told that losing any amount of weight is better for our overall health. What exactly does that mean?
Well, just losing, say, 5% of someone's excess weight, which is the weight over what we're supposed to weigh, can have dramatic impacts on things like blood pressure, things like your diabetes. Can also make a big impact on say, your joints, too. So it doesn't really take a whole lot to make a big difference.
So you probably see this every day in your clinic, how weight loss can impact diabetes.
Yeah, absolutely. I mean, it's one of the things that I went into this for. What I do, bariatric surgery, is one of the only ways people can obtain, I don't want to call it a cure, but they can be in remission from diabetes. And so no more insulin, no more medications, and they just live a normal life without.
All from weight loss.
All from weight loss, absolutely.
Wow.
Type 2 diabetes is almost entirely correlated with obesity in a lot of patients.
So does extra body weight make our hearts work faster or harder?
Definitely, definitely. The analogy I like to use is you have a farm with 20 acres and you're trying to irrigate 20 acres to get enough water to that 20 acres of crops. Say if you expand that farm to 100 acres, but you still have that same pump, that's going to be working a lot harder, right? And so that's the way I tell my patients how that works. So. It is definitely something that losing weight can lower our blood pressure, make it easier for that pump to be working better.
So what about sleep apnea and losing weight? Will that help, people to sleep better?
Absolutely. We can get a lot of our patients off their little nighttime snorkel devices, their CPAP machines. When people gain weight, they gain weight everywhere. And so if we're gaining weight in the back of our throats and we're lying down on our bed, that tissue is getting in the way of our airflow and leading to some dangerous sleep apnea episodes. And so when our patients are losing weight, then that tissue is getting smaller and getting that airway going through there better. And so we're able to get a lot of people off their CPAPs. So,
wow.
Yeah.
Well, thank you so much for all the hard work you're doing, Dr. Paul. If you would like to reach out to him, you can do so by contacting BaptistHealth-.com or calling the Baptist Health line at 1-888-BAPTIST.